As host, we've had a lovely lunch sitting next to Colin Hutchinson. We've had a lovely talk about all sorts of things, except the subject he's going to speak on today. So if you'd like to welcome Colin Hutchins from Prostate UK.
Prostate Cancer UK. Good afternoon, everybody. Thank you for inviting me along to your meeting today. You're not the first Rotary Club I've been to. I think I've been to the last 2 years. I work for Prostate Cancer UK as a volunteer, and I go around to men's clubs, which is Rotary, Round Table, Masonic lodges, etc., talking about the biggest killer of men, prostate cancer. Am I qualified to talk about prostate cancer? Well, you decide. 10 years ago, I had prostate cancer, very aggressive form of cancer. I'm still alive, so that must say something. Also, for my sins, I spent 6 years at medical college, came out with a bit of paper, and instead of going into medicine, as you know, GPs and so on, I went into medical computing. Now, medical computing, I'm 74 now. When I went into it 30 odd years ago, it was in its infancy. And the type of things that medical computing did were things like x-rays, various pathology, histopathology type systems and so on and so forth. As time has gone on, computers, as we all know, are more readily available and much cheaper than they used to be. Equipment that we were after I left medical school, I worked for a big American computer company because I could spell the word hospital, doctor, and a few other things I thought I would be useful to them because they wanted to get into the medical area. So that's where I come from, and that's what I've been doing for the last years. I'm retired now, by the way. So it's all been good fun. So Prostate Cancer UK, where is it? Well, Prostate Cancer UK was set up back end of the 90s with one simple aim: to stop men dying of prostate cancer. That's quite a sweeping statement. If you look at death rates and so on and so forth, the biggest killer of men with cancers are lung cancer and prostate cancer. Lung cancer gets an awful lot of publicity. Prostate cancer, until a couple of years ago, was down there. More men die of prostate cancer than women die of breast cancer. And you know the publicity surrounding breast cancer. So we are trying to raise the awareness of prostate cancer to folks like yourselves and other organisations. So the whole purpose of today is awareness. Now, I'll come out with one or two sweeping statements as we go along. But I will say to you, and I can speak from experience, medicine is not an exact science. What is good for one is not necessarily good for t'other. And I can explain that a bit later. So, what are we going to do today? Well, I'm going to tell you what the prostate is, where it is, what it is, and what can go wrong. Signs and symptoms of the prostate. Notice I just said prostate, I didn't say cancer. We'll see why in a minute. Also, you ought to be aware of your risk of prostate issues. And also you need to know what your rights are here in the UK when it comes to the prostate, especially prostate cancer. So where do we go from here? Right, the prostate itself. What is it? Where is it? And what does it do? The prostate is the size of a walnut. It's near the bladder. only men have a prostate, so I'm sorry. Ladies, you don't have one.
Apologise.
If you did, you'd be a miracle, I tell you. What does it do? Basically, it helps sexual function. It produces a fluid for the semen to work through for sexual reproduction. That's its aim. As I say, the size of a walnut. With prostate cancer, 1 in every 8 men will get prostate cancer sometime in their life. If you're Afro-Caribbean, it's 1 in every 4. If you are Far Eastern, i.e. Japanese, Vietnam, places like that, the incidence of prostate cancer is much, much lower. Why? We do not know. And I go back to what I said earlier on. Medicine's not an exact science. We're still looking at various things. Prostate cancer itself, Prostate Cancer UK, we don't have laboratories and what have you. We generate money, which we then give to medical people and research people to look into various things. How, what, why, when, and try and come up with some solutions. So, we look at our prostate cancer. How many men in the UK are diagnosed with prostate cancer each year? Any idea? 10,000?
100,000.
47,000 men a year are diagnosed with prostate cancer. 1 every hour, 1 man will die of prostate cancer in the UK. That gives you some idea of the size. At the moment, we estimate there are about 300,000 men living with prostate cancer or the consequences of prostate cancer. But let's just go back. As I said, the prostate cancer, the prostate is down near the bladder. Now, prostate cancer is a killer, but a lot of symptoms you get with prostate cancer are very similar to symptoms in other areas. You can have an enlarged prostate. Now, some of you older gentlemen may have gone through this process, enlarged prostate. And the symptoms that you get with an enlarged prostate are very, very similar to that of prostate cancer, i.e. difficulty passing water, frequency of going to the toilet, especially at night, things of that nature. Maybe problems from a sexual point of view, getting an erection and so on. Now, that's an enlarged prostate. You come into prostate cancer, almost the same. So the medic, the doctor, has great difficulty in deciding what it is. Now, how does he do it? How does he find out? Well, there is no one test that will say you have got prostate cancer. The most common way that it's done here in the UK at the moment is with a blood test. And that's where they have a PSA test, prostate specific antigen. So you go, take blood out, it goes to the pathology lab, and they will say, have a look at it, and you might have a high XYZ count or a very low one. If it's high, you look into it a little bit more. In fact, for a number of years, mine was about 3. 6 months afterwards, it went up to 16, and that's when my GP, who happens to be a friend of mine, said, I won't use the exact words, but it was, oh dear, we have a problem here. And so I went and saw a consultant that I happen to know, and we had had a little chat about things. Then you have a biopsy. And what's a biopsy? Well, it's quite simple. You take a sample of the prostate. How do you do it? Sorry girls, I don't want to sound crude, so close your ears for a second. This is where, gentlemen, you literally bend over, almost, and something is inserted into you. And they snip about 12 samples. And those samples then go to the path lab, and they will find out whether that is cancerous or not. 12 samples. Now, it's not a lot in actual fact. So what else can we do about it? Well, now, since I had that type of thing, now with MRI scanning, there's some new developments there. Not every hospital has got the equipment, but there, with an MRI scan, a good clinician can look at the prostate and see whether it's cancerous or not. What causes the cancer? Well, basically the body, as you know, is made up of cells, and they die and they reproduce. When it becomes to prostate cancer, the cells die and then they reproduce, but they might reproduce in an uninformed way, or they might be, some die off, some will be malformed, and that becomes cancerous. Another way of finding out whether that prostate is cancerous is a rectal examination. And by some curious coincidence, I would like to demonstrate that. So, have I got a volunteer? No? What happens there, this is when the doctor inserts his finger into your backside and feels the prostate. It should be smooth, if it's okay. If it's lumpy, that's when another sign that it could be cancerous comes up. So there's no one test that can actually tell it. It's a number of different tests to look at that prostate to see whether it's bad or not. If it is bad, what can they do? When I was diagnosed with it, I spoke to four friends of mine that I was at medical school with, and I said, let's be blunt, what would you do? And every one of them said, have it removed. And that's what happened to me. The prostate was taken out. 10 years ago, that was classified as a major operation, because after you have it, you're in intensive care for 12 hours. Nowadays, you can do it through robotic surgery. It's much, much easier. You can be in and out within about 3 days, which is great. Now, what else can we say about it? Using the MRI scan, that doctor can see whether it's bad or not, as I said, and he can take the appropriate action. Action being, you can have some form of, and I won't confuse you with all the technicalities, but some form of radiotherapy, which is designed to kill the cancerous cells. You will see in the newspapers lots of things coming out, in the BBC and so on, like new prostate therapy recommended for the NHS. You will get prostate cancer diagnosis breakthrough hail. Yeah, they're all coming. It's all coming, and it's getting better month by month, year on year. But when you read these things in the paper, and the Daily Mail is probably the worst, by the way, saying this is coming, and you can do this, and you can do that, yeah, you will, in a few years' time, after it's gone through all the various processes for approval. But you can, we're going to kill prostate cancer, full stop. That is our aim in Prostate Cancer UK. people will be able to be cured of it. So that's some of the things that are going on. But as I said, we're talking about prostate cancer, but there are other things. You can get, the prostate can become inflamed, and that's treatable with drugs. That's quite straightforward. An enlarged prostate can be treated by minor surgery. It can be also treated with certain drugs and so on, which will shrink the prostate itself. The other thing you ought to be aware of, as we get older, as men get older, the prostate will enlarge. That's a natural process. However, we can, as I say, shrink it, and you can almost be back to normal. Let's look at the worst side of things. You've got prostate cancer. You either have it removed or you have all these various things. What are the side effects? The two major side effects. One can be incontinence. The other one is sexual malfunction. Both are treatable these days. With the sexual point of view, there's drugs like Viagra, which can help the man to rise to the occasion. And that's common, that's a very common thing to have. What else can we say? Sorry, I lost the train of thought. Incontinence. I tell you, that was my biggest fear. When they said to me, you've got prostate cancer, and we'll operate in X number of days' time. Sugar. So what did I do? I was doing pelvic floor exercises every hour, well, every minute of every hour until the operation. And basically that just tightens up everything. The result is I have got no problems whatsoever with incontinence. I hope. No, I haven't. The other side, the erection, as I say, Viagra, so that problem is solved. In many, many cases, not all cases. You can, if that is still a problem and the drugs don't do it, there are other things like a penile implant. You can get that on the NHS here in the UK, or you can have it done privately at a cost of about £10,000. I can give you the name of a very good surgeon that does that, and I'm not on commission. So there's all sorts of things you can do. So prostate cancer at the moment is a killer. It's not going to be a killer in a few years' time, because you guys, what are you going to do? You're going, oh yeah, prostate cancer. You're all over 50, I guess, yes?
Just a little bit.
Except this young man, he's too young. So what are you entitled to do? You can go to your GP and say you want a PSA test. This is the first test that they will do. That doesn't cost you anything. Some doctors will turn around and say, no, I don't believe in that. That is a load of nonsense. You are entitled to have a PSA test. Insist upon it. If your doctor won't do it, or whatever reason, go to another doctor. Change your surgery. But the PSA test is the first test you undergo. And there we can, as I said, we can go into all the other tests and so on and so forth. So, what are you going to do after today? You're going to ring your GP up and say, hey, I'd like to make an appointment because I want a PSA test. And what will he do? He'll sign it, he'll give you a form, and he'll send you off to Broomfield Hospital, Queens, or whatever. You have a blood test, results go back to him. Hopefully it'll be okay. If not, then further action is taken. But it's all, I'm blasé about it because I deal with it all the time. It can be treated, but don't let it bug you all the time. I have to give talks to various surgeries and one-to-one. And guys come in, they're almost in tears. I've got prostate cancer. I'm going to die. We're all going to die. They might die a bit earlier, but might not. So go and have that PSA test and take it from there. So don't hesitate. Now, I can go on and on and on, but what I'm going to do is leave with you this fold-up thing. And that will tell you about prostate cancer, symptoms and so on and so forth. It will also give you telephone numbers that you can ring on a confidential basis and talk to a qualified prostate cancer nurse. And if they think it's serious enough, they can pass you on to a doctor. So every one of you will take one of these back. I've also got with me a load of other bits of literature, such as Enlarged Prostate, a guide to diagnosis and treatment, Prostate Cancer and Your Sex Life. If you're close to a person with prostate cancer, there's a guide for the family. For those, there's nobody from an Afro-Caribbean background here, but there's a leaflet here for people with that. As I said, 1 in every 4 black people will get prostate cancer. With a white man or Caucasian, it's 1 in every 8. That's there. Prostate cancer, a guide for men who've just been diagnosed with prostate cancer. There's some I don't expect you to say anything, but if you have been diagnosed with it, this might be of use. I'm almost embarrassed to talk about this one. Prostate facts for gay and bisexual men. Well, that doesn't apply to anybody here. You never know these days. So, there you go. Now, if any of you want to sit down with me and go through it in a lot more detail, I co-authored a book on nuclear medicine. And this shows you all sorts of weird and wonderful things, what the prostate does and how it works, and all very boring. Now these books cost, I think they're about £25 each. But as I've got 5,000 of these in my garage, they're available for you for 10p a book. So what I've tried to do today is to give you an awareness. That's all it is, an awareness of what prostate cancer is and what you can do about it. If you don't do anything about it, nobody else is. Now, when you're diagnosed, let's say you're diagnosed with you've got prostate cancer. The clinician, i.e. the surgeon, 9 times out of 10, will say, what do you want to do? No doctor will tell you what to do with prostate cancer. Why? I don't know. But that's a fact of life here in the UK. You make the decision what you want to do. You may decide not to have anything done to you, and therefore you'll be in a situation called watchful waiting, where you will be looked at every 6 months or every year by the doctor to see if the prostate has got any worse or possibly better. You can never tell. So fellas and ladies with husbands, partners, prostate cancer is out there, but you can kill it straight away by doing something about it. So I would urge you, have that blood test, PSA blood test, You can insist upon it, as I said. Go there. If you've got more questions, Prostate Cancer UK, they're based in Tooley Street in London. They've got a 24-hour call centre there. You can talk to qualified people about your situation. So you're not on your own. A lot of surgeries now are beginning to have prostate cancer support groups. Depends upon the size of the medical practice. Here in Essex, we are very, very lucky, because when it comes to cancer of all types, Essex is one of the best counties in the whole of the United Kingdom for the treatment of cancer. We're lucky we've got Queen's, Broomfield Hospital, Basildon, Southend, and one or two other, Princess Alexandra in Harlow. You've got great guys in those places that are experts in urology, which is the cancer side of things. So you're in good hands. So I just want to leave you with a thought. Go and see that doctor. Get your PSA done. If there's a problem, you can start treating it. If you leave it, that's up to you. But don't. I could have left it, and I could have been dead a million years ago. I had it treated straight away, and I'm still around. Better or for worse, according to my wife, for worse at times. Oh, by the way, she's a clinical psychologist, so I get it in there all the time. But have I helped you? Give you an idea? If there's any of you doctors?
Loads.
Have I said anything wrong?
You have not said anything wrong. The biggest problem in prostate is we men are ashamed of going to the doctor to do exam.
Exactly. You've hit it on the head.
And I mean, I have worked as a GP for 50 years for the NHS. Whenever you ask a man, can I examine you for prostate? Doctor, I'm not ready. I'll come back tomorrow. And then you can't ask the wife because of the confidentiality that I told you. So we are still left with that. When I have examined people, I have found that cancer. There was one guy, I can give you an example. My wife wanted only blood test, not examination. He refused. One day, my wife insisted that he should have the PSA. PSA was 96. And the hospital rang, doctor, his PSA is 96. So we rang him, come and see us. He wouldn't come. So we rang his daughter. She said, I will go and bring him. She went and brought him. And when he had his second PSA, it was 100 and something. The guy was treated, and later on, he was very grateful. My wife was on holidays, and when she came back on holiday, this man is sitting with a bottle of wine, flowers. You saved my life. So this is the biggest problem. Is the shame. I'm not going to suffer. That's the answer.
Yeah.
Oh, it's not. I won't be suffering. And that's it. But you don't know who's going to be happy.
And men, being butch guys, no, you're not going to play around with me, I swear you're not touching me. Oh, no. That's natural. That's the biggest barrier to get over.
Can I make a comment that I've had prostate cancer, and it was diagnosed purely by chance through one of these 3 early blood tests.
Yeah.
So I had no idea that I had any problems. I had no indication of wanting to go to the toilet 3 or 4 times a night, or none of that. So it was purely having a regular checkup. So I would endorse what you say. Even if you don't think you've got it, go and see the doctor and have a PSA like that.
Well, as I said, I had prostate cancer. I didn't know. It was only by chance. When I had a blood test, it went up to 16. And reason I had blood tests every 6 months or every year is I used to fly, and medical aviation, medicals are very, very strict. And that's why I was going every few months to have tests. But I felt fine. I felt absolutely fine. I was, well, jogging in those days. I was slim in those days, purely by chance. But for goodness sake, fellas, go and see your GP.
Yeah.
They're nice guys, aren't they?
But they're not all like before. I mean, before the PSA came, we used to use our fingers.
Yeah, did you want my glove?
That's not a glove for example. That's a gardening glove. We used to do the examination by finger. Then the PSA came. PSA came, but the government or the NHS would not let us do it because they said it's a very expensive test. And they said, unless the patient says, can I have the PSA, you can't suggest him to have a PSA. Now the things have changed.
But they're still not happy, you know, you have to ask. If you've had it and it's
It's
not...
still not arbitrary.
I've got to say, I need PSA on my blood test, you know.
Yeah.
You need to ask for it, or they won't do it. They won't, when they do your cholesterol and this sort of thing, I mean, 6 months, if you don't ask for PSA, they won't do it. Even though they've been doing it for me for years.
Just
You have
tick
to
the
say,
box.
I'm not the PSA, and then they'll do it.
Yeah, tick the box yourself. One interesting thing is I'm involved in a lot of research and development, especially with the University College Hospital and Royal Marsden. One big theory at the moment going around when it comes to prostate cancer is diet and weight. A lot of people are beginning to say if you've got the right diet, it reduces the risk of prostate cancer. If you're at the right weight, it will reduce it. Now, that's a theory going around at the moment. Whether it's going to be borne out by clinical trials, who knows? But prostate cancer is one of those things we can talk about for weeks on end and never come to a conclusion. But you've heard it from this man. Go and have that PSA test. If you don't, it's your problem. So don't expect him to cure you. He won't.
Thank you.
Sorry, I've rambled on. Has it given you an idea?
Yeah.
Colin, will you answer any questions if anybody's got? I know several discussion has taken place already.
I'll leave a load of
Specific
these
questions?
here for you.
Yeah.
Yes, Carol?
The PSA test,
Yes.
what is the starting figure? You say like 16, or what should it be? 0?
Depends a lot on the metabolism of the person. If it's about 3, you correct me, 3 to 4, you're okay.
Oh, yeah.
If it rises like
Yes.
7, 8, 9, 10, and it rises over a period of time quite
Right,
quickly,
okay.
that's when you really should be worried.
Yeah.
In mine went, as I said, from 3 up to 16 in the space of 6 months.
Yeah.
Sometimes you can see blood in the urine as
Yeah.
well.
Yes, oh, yes.
So when you put two things together, you become very suspicious.
Yes.
And I mean, in the local area hospital, we have got a system called 2 weeks wait. Wherever this thing is suspected, we refer the patient to the hospital, and within 2 weeks, he's supposed to be seen by the doctor.
Yes.
And there's no delay. And the only thing is you have to tell the patient, you'll be hearing within 2 weeks, and they get the letter.
Right. Okay.
Any more questions?
Service in this area is very
Sorry.
good.
Yeah.
Only thing is that you have to go for it.
Yeah.
Sitting at home, service is not going to come to you.
Is it?
I just seem to remember once we had a speaker here many years ago, I believe, who left the impression, or he may have said, that more people die with prostate cancer than of prostate cancer. Is there any truth in that?
Again, with prostate cancer, some of it, you might have prostate cancer, but it might not be an aggressive form of prostate cancer, and you could die of something else. You can have very aggressive prostate cancer, which I had, and that could spread to the other parts of the body, especially the bones. And if it goes into the bones, goodbye.
Yeah.
Now, I've done this type of talk to a number of people, and I've had about 8 people say to me, I went and saw my GP, I've had the test, I've got X, Y, Z, and they've had appropriate treatment. And how much does that cost? Go do it.
Repeated as well. If it's now today better, it will be now and tomorrow.
That's right.
You have to have it repeated at least once a year.
Now,
Any more questions?
any other questions? If there are any future questions, you're very lucky, you've got a man on the spot. But if you're embarrassed in talking to him, which you shouldn't be, you've got the telephone number of Prostate Cancer UK, you can talk to them.
Thank you. Can
Does that help?
Thank you, President. Yes, I don't think a lot of thanks is necessary from me, Colin. Obviously, what you described to us, is, for all of us, I think is very, make us think. A lot of us, I'm sure, have already had the various checks, haven't you? But, because strangely enough, when I did approach my doctor, I got the reaction you mentioned. He looked at me and said, it's up to you. Do you want to go have a P&L or not? And I said, well, and, he gave me a slip. On one side the do's and on one side the don'ts. He said, you don't want to make your mind. I found it very good, you said, you think, well, because I had no symptoms, that you've described, so I was naturally concerned. I thought nothing about it, I probably will now. But, so you don't get all the help, it's very strict. No disrespect to you too much, but, we don't get all the help from the doctors. But obviously you've made it very clear to us that we need to consider it and take action. So, from my point of view, I'm sure everybody else's. Thank you very much for joining us. Thank you.
I don't know whether I should say this or not. It's just a small advertisement. Viagra is available over the counter. And a special discount for my Rotarian.
Can we buy in bulk?
4 at a time. Maybe any other business.
Untitled Chapter for people come?
Yes, I think it was all.
Next week's menu, see the website. Please contact Jeffrey by Monday evening if need to change. Remind you of the ecologist book. Menu, as I've already said. Please be upstanding for the final.